Dr. Anthony Fauci created quite a stir this week when he hinted that he may retire. But the nation's top infectious disease expert then said he does not have an end date in mind. He will likely retire after President Biden's term is up. Dr. Fauci joins us this morning. All right, how you feeling? First of all, Dr. Fauci, because we know that you had COVID, you were a rebounder. How you doing?
Rosanna, I'm doing really well, very well, and I really feel fortunate, and I think this is a testimony to what we've been talking about all the time of why it's so important to get vaccinated and boosted, which I was vaccinated and boosted twice. I got this first boost and then the second boost. I got COVID, and my course was relatively mild. I went on Paxlovid. I did well. I had a little bit of a rebound that lasted about a day. Went back on Paxlovid, and since then, fortunately, I've not had any residuals. So I really feel like I'm back to 100%. And again, that's the reason why I reach out to people who are hesitating to get vaccinated, people, particularly those at my age, who when you get to this level of age, that you have a higher degree of likelihood of going on to a serious consequence. And fortunately, I didn't. But thank you for asking.
Well, I'm glad that you're feeling better. Do you feel like people are getting complacent? They feel like it's the endemic, it's the end of all of this, and they want to move on with their lives?
Well, it's perfectly natural for people to feel. All of us have been under this burden for 2.5 years. So everybody, myself included, wants to put this behind us into the rearview mirror. But you've got to face reality. We still have a high level of dynamic of infection. And as you mentioned in an earlier part of the show, there are people right now who continue to get infected, hospitalized, and dying. We're averaging about 300 deaths per day. That is an unacceptably high level. And you don't want to equate being realistic about this outbreak with altering your life in a way that essentially paralyzes you. You've got to reach the point where we're going to have to live with it, but you can live safely with it by doing some prudent things. We have 67% of our population is vaccinated. Among the order of the world, of other countries, we're really quite low. We should be up to 90+%. Of the people who are vaccinated, only half of them have received a booster. That is unacceptable, Rosanna. I mean, we don't want to, encroach on people's freedom or anything, but we're just recommending do the things that could help protect you and your family and indirectly protect society by doing some just common sense public health measures.
Dr. Fauci, when you say those recommendations, you were the person that recommended that you just needed to get a vaccine and one booster, and that would originally be enough. Obviously, it sounds like you changed your stance on that. But, I mean, these boosters, when we get them, it's taking care of a variant that was, going on 6 months ago. They're outpacing the vaccines. So do people need to keep doing this every single year? I'm talking about for most people, not people that are in an older, age range, or people that are, immunocompromised. But is this for most people? They need to keep doing this?
So, Bianca, with all due respect, I want to correct one thing that you said. I didn't change my stance. The virus changed. The virus is the thing that is evolving and continuing to get variants. What we need to do is to get vaccines and the appropriate recommended boost. It is entirely conceivable, Bianca, that when we get to the fall, we will need to get a boost because the durability of the protection isn't like with measles, where it lasts decades, if not a lifetime. And we're dealing with a very unusual virus, one that continues to vary.
Yes.
And that's really a problem. I mean, that's not something where we're flip-flopping in our stance. We're trying to keep up with a very formidable virus that in an unprecedented way changes.
We totally know that it changes. I do want to ask, though, because we're talking about the boosters and vaccinations. Do you still believe that we're looking at someone like Novak Djokovic, who cannot play in the U.S. Open because it can't get to the U.S. without a vaccine, who has had COVID? Do you still think that is an unfair rule? Is that an unfair rule for him?
No, Bianca, we don't, and this is a big misunderstanding. As public health officials, we make recommendations for what is appropriate to preserve the public health. We don't mandate. Mandating is at a local level. We leave that up to local officials to decide on the basis of what the situation is in their own location, be that a county, a city, or a state. So I've never said that we are going to mandate this. What we say is these are the recommendations, and the CDC makes recommendations. The local authorities do the mandating.
So in other words, you got nothing to say about Djokovic playing in the U.S. Open. We're all disappointed he can't play here.
Yeah, well, I'm sorry, too. I mean, you'd like to see people being able to do what they do well with their profession. But again, the only thing we can do is make recommendations for public health. And people really need to understand that's a local decision.
Gotcha. Can we talk about masks in schools? What's your recommendation? Because right now our governor is saying kids do not have to wear them right now, but she's keeping that option on the table.
Well, again, I am someone who vocalizes and puts forth what the CDC recommendations are. The CDC has a large number of professionals who analyze the data all the time. And when they make a recommendation that in those areas in which you have a high level of viral dynamic, the recommendation is to wear masks in the school. Now, the decision about whether or not that is or is not done, again, Rosanna, is a local decision, which we do not interfere with. We only provide the data that gives us the recommendation.
Gotcha.
But the decision is local.
Monkeypox. Do you think this will turn into a pandemic? Should we be concerned?
Well, we need to take it very seriously. There's no doubt that we are dealing with a significant problem. What people need to understand is that we do have tests, we do have vaccines, and we do have antivirals. What we need to do is to make sure that those interventions are available to those who need them. Now, early on, it was a situation where the demand was greater than what was available, particularly with regard to vaccines. But now that is changing rapidly. Initially, there were about 140,000 doses that were distributed. Last Monday, another 130,000. And by the end of July, there should be about an additional 748,000 doses of the Jynneos vaccine available. Hopefully, that will help to contain something that is a worrisome outbreak. We can't walk away from that. This is something that we are concerned about.
Gotcha. Well, we always appreciate you coming on Good Day New York. Of course, like everybody, when it went viral that you were retiring, the Wall Street Journal has a report out now. Will you retire before 2025, before President Biden's term is up? Everybody's speculating this morning.
Yeah, I have not made up my mind when I will step down. But the one thing I want to clarify, Rosanna, for my friends in New York, the word retirement is a misperception of what we're talking about. If I walk away from government service, I am not going to retire. I'm going to continue to do the things I do, which is everything I can to preserve the public health of this country and the world. And that's the reason why I flinch when they use the word retire.
Thank you. I knew it. I knew because, Brooklyn, I mean.
You can't stop working.
He was 2 blocks away from my house in Brooklyn. So I knew there was no way he was going to sit back and, plant tomato, plants.
You got it, Rosanna. Absolutely. You got it.
Anyway, Dr. Anthony Fauci, thank you so much for being on Good Day New York.
Take care. Love you. Bye.
Thank you.